Real friends don't count an extra chromosome. What a wonderful statement made by a high school student. Hi, my name is Devi. Today I'll be talking about neurobiology of the Down syndrome. So, what is Down syndrome? It is the genetic disorder caused when abnormal cell division results in an extra full or partial copy of chromosome 21. Individually, Down syndrome have 47 chromosomes instead of the 46 chromosome. This extra genetic material causes changes in the developmental of intellectual and physical future in Down syndrome. It occurs in about 1 in 700 to 800 births. There are 3 types of Down syndrome: trisomy 21, translocation, and mosaic. Trisomy 21 is caused by a faulty cell division that results in the baby having 3 21 chromosomes instead of 2. The extra chromosome is replicated in every cell of the body. This is caused by abnormal cell division during development of the sperm and egg cells. 95% of all people with Down syndrome have trisomy 21. Another type of Down syndrome is translocation, which happens to 3 to 4% of all cases. It occurs when part of the chromosome becomes attached onto another chromosome. Patients with translocation have 2 copies of chromosome 21. Translocation may indicate that one of the parents is carrying chromosomal material that is arranged in an unusual manner. And lastly, mosaic. Mosaic is the rare form of Down syndrome. A person has only some cell with an extra copy of chromosome 21. It occurs when non-disjunction of chromosome 21 takes place in one of the initial cell division after fertilization. It only happens to 1 to 2% of all cases of Down syndrome. What is the epidemiology study of the Down syndrome? Down syndrome is most commonly known cause of intellectual disability. Every year, approximately 6,000 children are born with Down syndrome, which is about 1 in every 700 babies born. The chance of women conceiving a child with Down syndrome varies from 1 in 1,400 for 20 years old women to 1 in 32 for 45 years old. The prevalence of people with Down syndrome in our community has increased over the recent decade due to the dramatic increase in life expectancy. In 1929, a baby born with Down syndrome often didn't live up to age 10. Today, someone with Down syndrome can expect to live 50 and beyond, depending on the severity of his or her problem. Sometimes people ask questions like, can a Down syndrome person have a Down syndrome child? Well, most of the time, Down syndrome is not inherited. It is caused by mistaken cell division during early development of the fetus. Women with Down syndrome can have children, even though they have 35 to 50% chance that their baby will have Down syndrome. Unfortunately, many men with condition are not able to. However, it is still possible. Let's move on to the neurobiology of the Down syndrome. Neurons are composed of cell body, axon, dendrite, and nucleus. The chemical travel between the synapse along the axon is what allows the brain to work. It appears that the process affecting the nervous system in Down syndrome not only affect microanatomy of the nerve cell but also affect nerve function. We know that people with Down syndrome have difficulty with brain function as well as the onset in later life of increased cognitive problem associated with brain changes of Alzheimer's disease. There are 2 proteins that is overexpressed by Down syndrome, which are phosphorylated tau and APP or beta-amyloid precursor protein. In normal people, tau maintains the function of axon tubules. Its phosphorylated form causes twisting of the tubule, which results in neurofibrillary tangles. When APP protein cleaves, A beta is formed. This molecule poisons the synapse and resulting in cell death and the formation of beta-amyloid plaques. The combination of these 2 processes is what causes Alzheimer's disease and to those with Down syndrome. They often suffer from early onset of the condition. Other characteristics of Down syndrome are enlarged early endosome. Endosome act as a communication packet for neurons to transfer molecules. In Down syndrome, these enlarged endosomes are the result of carrying high concentration of A beta, which will limit protein to travel in a very slow pace and also decrease signaling speed in neurons. What are the common features of Down syndrome? Features include flattened face, almond-shaped eye, a short neck, small nose, mouth and ear, white short hand with short finger. What is the risk factor for Down syndrome? Some parents have a greater risk of having a baby with Down syndrome. Risk factors include advancing maternal age, being carrier of the genetic translocation for Down syndrome, having had one child with Down syndrome. Some of the complications are heart defect, leukemia, and dementia. Also, there are other problems which associated with health condition, including endocrine problem, a dental problem, etc. What is the treatment for Down syndrome? There is no single standard treatment for Down syndrome. People with Down syndrome can receive a proper care while living at home and community. While there is no cure for Down syndrome, there are therapies available to improve the quality of life. Some of the therapies are speech-language therapy, physical therapy, occupational therapy, assistive technology, drug and supplement, early intervention, and educational therapy. Conclusion for Down syndrome. Their lifespan is around mid-50s, depending on severity of the condition. Down syndrome affects other systems by putting you at risk for disease that affect various systems of the body. There is no specific treatment for Down syndrome, but they have a chance for a normal life. Thank you.